The Commissioner for Health Promotion and Education at the Ministry of Health, Paul Kagwa, noted that having breastfeeding corners at the workplace cuts across both government and private organizations. He also adds that an employee has a right to drag his or her employer to the courts of law in case of failure to grant expectant or new mothers a 3-month maternity leave, or even failure to have a breastfeeding facility.
Mothers who are breastfeeding should be given an opportunity at place of work to continue breastfeeding, meaning they should set aside a place, like Parliament has done, a breastfeeding corner, so that when a mother feels they're going to breast, or when a child cries, the mother has a place where she can go and breastfeed the child.
Men were also encouraged to be supportive to their breastfeeding wives.
Men, we are in trouble. My appeal to men is that support your women, your wives, to breastfeed. When do you start supporting? From the time you make that woman pregnant, make sure that she's well fed. Give her good food so that both her and the baby are healthy.
United Nations Children Fund findings indicate that in Uganda, mothers have not yet fully embraced breastfeeding, with only 45% of mothers breastfeeding their children up to the age of 2, and only 53% breastfeeding within an hour of their baby's birth.
When we read the statistics for Uganda, how long it took Uganda to move to the 63% exclusive breastfeeding, and how long it will take us to get the remaining 34 or 37% of our children exclusively breastfed.
Mothers continue to argue that breastfeeding in public has a lot of stigma, and thus the demand for special consideration.
Mothers feel uncomfortable to continue breastfeeding from public places because of the stigma attached to it. Most times they are told off, or sometimes the people around them don't treat them well, and they have perceptions, for example, about breast milk.
Anyone who has been a mother knows that mothers will tend to lack confidence in themselves. They'll tend to lack confidence in how much milk they have. But if they come to specific places like the breastfeeding corners where they know there's support, the other mothers who are sharing, caring for one another, they can be encouraged to really breastfeed.
Rwanda has the highest rate of children breastfed exclusively for the first 6 months in the region, with 85%, followed by Burundi at 69%, Uganda at 62%, Tanzania at 50%, and then Kenya at 32%. Mothers have continued to beat the drum, demanding for their rights. They're advocating for their employers to welcome their babies at the workplace. They argue that this will be the only way for them to fully breastfeed their children, as well as concentrate on their work. Juliet Namwaya, Urban TV.